Good afternoon, everybody. Thank you, chairpersons, for the kind introduction. Dr. Vijayakumar and the organizing team for inviting me. So I was asked to talk about mind-body medicine. I'm not an expert on it. That's the first caveat. I don't know how many of you have heard the concept mind-body medicine. We all know. All our bodies are here. We don't know. I don't know if your mind is there to listen to me, but I'll make sincere efforts to get this mind and body medicine across to you in a structured format. What is exactly mind and body medicine? I would like to begin with Hippocrates saying, I would rather know the person who has the disease than know the disease the person has. We all know, we've been taught to listen to the patient. We all listen to Dr. Krishna's cases on diabetes. Apart from the conventional wisdom and apart from conventional therapies we still fail to achieve targets. There are various diseases which we need to understand. The mind plays an important part. So how do we do this? And what is this mind-body medicine? Mind-body medicine focuses on the interaction from the brain, mind, body, and behavior, and on the powerful ways in which emotional, mental, social, spiritual, and behavioral factors can directly affect health. How many of you think that this is true? And do we practice anything to improve this part of it? I don't know. I've not been doing, oh, nice to see somebody. We'll talk about it later, because I came to know of a lot of techniques which are there and whether these techniques can be used to improve outcomes in patients with different types of disease. And what is the background? It started somewhere around 2000 years ago when Hippocrates recognized that moral and spiritual aspects of life, belief in them helps healing. 16th and 17th century led to separation of human spiritual or emotional dimension from the physical body. They started separating it, like compartmentalization, like every disease and disorder has a compartment and everyone has a specialist. Nobody's thinking in a holistic way. So fixing or curing an illness became a matter of science, technology, driven by data, and that took precedence over not a place besides. It should have been placed besides the regular treatment in the part of the treatment algorithm after I heard about it, of healing the soul. So these were the words. So science, we have the science which took over this. But the oldest inscriptions of mind and body medicine go back to Ayurveda and traditional Chinese medicine. Only two of these sciences really took all of this into consideration. Behavior, spirituality, the type of other problems you have with the disorder to do it. And 1964, they started doing certain experiments. George Solomon worked on rheumatoid arthritis and some people associated with depression, worked with their mind, and he found that people who were put into sessions saw that improvement in pain to 30 to 40%. 60 to 70, one of the landmark studies was blood pressure reduction with meditation. And 75, they thought that if you worked on your mind, good emotional and mental support improved immune system. Now, the problem with all these things require a longer time. We don't have patience for that. Given a drug, I want the results after a certain time. But when you don't find it, we give all the drugs, still you're not able to achieve the targets, and then you need to keep searching for other things. And what are these? And what are these techniques which are available? So if anybody knows about the placebo and placebo effect, this was one of the first things described. In World War II, lack of morphine, injured soldiers, there was no morphine, one of the physicians, Henry Beecher, gave saline. And 35% of the patients felt better without the morphine. Then that is the time when he coined the effect, placebo effect. And that is in discussion through ages. All medicines are, all trials, usually randomized controlled trials. For data, you need to compare it with a placebo. Placebo may itself have an effect, and that can be up to 35%. I'm not here to discuss and debate about the placebo effect, acknowledge the placebo effect. So, what is this mind and body medicine? What are the techniques which can you use to make sure the focus on this interconnectedness of mind and body recognizing that thoughts, behavior can influence physical health, interconnectedness, relaxation response, stress reduction, improved well-being, diverse technique, integrated and conventional medicine. How, I don't know in India if you have a mind and body clinic. I Googled, I was surprised. Some of the best ones are in the US, like Solon Catering has one. There's one in Johns Hopkins. They have separated, dedicated mind and body clinics, and their mind and body medicine certified courses for those who are interested. Now, what are the examples of these mind techniques which are there? Meditation, yoga, Tai Chi, guided imagery, biofeedback, and hypnosis. What I'm going to do in the next 4 slides is going to tell you what is these relaxation techniques which these mind and body therapists use. It's usually, these are practices whose primary stated goal is eliciting a psychophysiological state of relaxation or hypoarousal from an excited state in whatever that individual is, to make sure that that stress or that hypophysiological state. Suppose your muscle is under stress, so you relax the muscle, de-stressing. Something like this. One of the best prominent example is called the Benson's relaxation. It's one of the type of relaxation technique where you achieve a hypometabolic. Say if you're going into a calmful, all these wellness clinics are based on this mind and body medicine. So other thing, our people are talking to it for ages. I don't know, for thousands of years. Meditation. There are 2 types of meditation. One is transcendental meditation. You just chant a mantra. The same thing you keep on chanting. That is one of the techniques. Or mindfulness meditation, in which practitioners simply observe or attend to, without judgment and thoughts, emotions, sensations, and perceptions. So I'm not an expert. I've never tried meditation. I thought I should try. And I know people who try meditation who find it effective in their well-being day in, day out. Yoga, as part of one of the therapies, it's also physical and it also has de-stressing things. Now, what is this? There's another technique called guided imagery. Is either by oneself or guided by a practitioner. What you do is, imagine that you have a infection, a chronic infection. You tell the patient, the cells are fighting it and they're fighting very well. It's an image of your disorder and you're fighting this disorder. And that way, immune system, these guided imagings are helpful, especially in improving immune systems. Hypnosis, we all see this as part of probably in a movie or used by psychiatrists or psychotherapists. So there are different types of hypnosis, especially if you take a patient in 3 types of, one is absorption or intense involvement of the central object. They put the concentration of the patient on a subject, on a central object, and he forgets his surroundings. Similarly, disassociation from the surrounding. This requires training. You need to be a hypnotist to try and do this. And these type of things are especially they work very well in anxiety, phobias, and so on and so forth. Biofeedback. This is also a technique in 60s. This is using technology. Suppose you have you give a watch with his heart rate on that patient. The patient looks at the heart rate. When he's monitoring the heart rate, there are certain situations, people who have anxiety, who are type A personalities, many people who heart rate increases for various reasons. So you give them techniques by saying, look at your heart rate, tell them some technique or one of the techniques to get that feedback. The feedback is reduction in, they say take a deep breath, relax. So something like that. These are the things. This can also work for migraine. Biofeedback especially is works for chronic pain and especially in patients with blood pressure and increased patients with type A personalities and so on. Cognitive behavioral therapy, and we were all talking about how Krishna was talking about how cognition, very important in elderly as you get older. So the emphasis, the role of cognitive process in shaping affective experience and argues that problematic emotions such as anger, depression, and anxiety result from irrational or faulty thinking. You're thinking that you're going to be doomed. Something is going to happen 3 days later. So all these people will have this. So for them, behavioral therapy helps. Behavioral therapy also is very effective in obesity, in patients with type 1 diabetes, and so on, because of so many other issues associated with them. Now, psychoeducational approaches. One of the best psychoeducational approaches which you can have is patient education. Yeah, the more you educate the patient, the more empowering the patient feels about the disorder, the more aware he is about chronic disorders, and the more he knows that these are going to cause, and repeated psychoeducational approaches have a lot of effect on chronic disorders. So, mind and body interventions. So there is evidence that these interventions, mind and body, can be effective in treatment of coronary artery disease, especially cardiac rehabilitation, heart failure. So what I'm going to do is, give me a minute. So there is effect, just to tell you, sorry, the effect of placebo. They are PET scan studies, especially in Parkinsonism patients, that giving a placebo and looking at their dopaminergic response. This is a randomized study which was done to see PET scan placebo in a Parkinson patient versus a dopaminergic agonist. They found that there is, if you reinforce these strategies, there is an increased response to placebo, especially in patients with Parkinson's. Stress and wound healing, there's individual differences in wounding have long been recognized. I've suggested that negative mood or stress is associated with slow wound healing. So here giving them positive feedback that your wound is going to heal itself works on to improve wound healing. Surgical preparation. We all know, yesterday also there was a study which said, now a lot of people pray. And one of the important statements is there are more honest prayers in the ICU rather than in the temple or a church. More honest prayers are held there. So this prayer, somebody coming to the patient, talking positive about the disorder, telling him that he will go get well. We all thought this was something, some guy is coming and praying in front of them. Actually, it is encouraged and it helps people recover faster. There's data which says that these type of things will do well. Does it work? The question is, does this work? Do we have evidence of this? So I can't go through all the evidence, but I summarize it with a couple of slides later in terms telling you about 26 systematic studies. It works, especially standard breast cancer treatment with weekly support group. Support group, especially for various disorders, these support groups have helped people and they live better, their morbidity is lesser. And hostile attitude, being very increased, we all know increase cardiovascular risk. Is there evidence? So the best I could look for, there are many. I can't go. See, now the problem with this is there is no control. There's no placebo control for these studies. How do you look at? So there are different techniques. Should we use one technique? This technique is enough to get this outcome from this disorder. So what are the things? There are 28 systemic reviews. There's close to 2.5 lakh patients who have been tried different techniques, relaxation technique, yoga, meditation, hypnosis, and so on and so on. The best evidence especially is for blood pressure, pain. Moderate evidence is available for other techniques. The limitations of trying to do studies like this is you can't compare one procedure with the other procedure. No study is there we're comparing this procedure. Relaxation is better, or can we do mindfulness or something, or yoga is better. You can't do this. There's a lack of data in it. But there is enough evidence to say that there is considerable evidence that array of mind-body therapies can be used as effective adjuvants to conventional medical treatment for a number of common clinical conditions where they can work. Cancer, blood pressure, asthma, coronary artery disease, obesity, pain, insomnia, diabetes, IBD, fibromyalgia, menopausal symptoms, perimenopausal, anxiety, depression, rheumatoid arthritis, and other autoimmune conditions. That means we should look for, apart from traditional medical management, probably look for all of these techniques, some of them which can be, which can be act as adjuvant in helping heal the patients. So to conclude, mechanisms may exist by which brain and central nervous system influence immune, endocrine, and autonomic functioning, which is known to have an impact on health. Multi-component mind-body intervention that includes some combination of stress management, coping skills. Cannot cope with this work. I've seen so many people coping with this work. Cognitive behavioral interventions, relaxation therapy, maybe appropriate adjuvant treatments for coronary artery disease and certain pain-related disorders such as arthritis. Multimodal, multi-mind-body approaches should be combined and used as adjuvants for many chronic conditions. An array of mind-body therapies like imagery, biofeedback, hypnosis, relaxation, when employed pre-surgically, may improve recovery time and reduce pain following surgical procedures. So, hope this hypnotherapy, visual change, all of these guided image, they all were new to me. I knew some of them, but thanks to Dr. Vijayakumar, he helped me learn last 3 days. Spent a week trying to put in everything. I thought to introduce the topic and just to say that something else is available to all of you, I could put a brief presentation for all of you to understand. I have not had any real-time experience in trying to deal with these therapies. The natural healing force from each one of us is the greatest force in getting well. We've seen patients, you think his prognosis is very bad. You'd be surprised we have not offered everything, but he's doing well. So maybe, thank you for your mind, for your body being present here. I don't know if your mind was there. Thank you.